Niamtu, lovethatface.com, and the question I get a lot is there such thing as a scarless facelift incision? Well, yes and no. First of all, anytime you make an incision on the skin, you're going to have a scar. However, there are some really important things that affect the final outcome of your scar with facelift surgery, and anybody that's ever going to have a facelift should watch this video to learn about these factors. First of all, this area heals well, and that's a good thing. And when people come in for facelift consults, the two things that they worry about the most are the scar and the anesthesia, and those are actually things at the bottom of the problem list because we rarely have problems with either. Now, I've done over 1,000 facelifts, so that means I've made incisions on 2,000 sides, right? Because you have two sides to each facelift. And I've been doing facial surgery for over 30 years, and I think I'm good at it, okay? If I didn't think that I was really good at it, I should send my patients somewhere else. So between understanding how to do these incisions and the fact that incisions heal well in this area, facelift scars are generally imperceptible. Now, there are several key things that we'll talk about, and I'm going to do a whole PowerPoint presentation in a second and go through these step by step. One is the temporal incision. If this is not made correctly, and I'm not a great example to talk about hairlines, okay, but if this is not made correctly, it'll elevate the sideburn, and women will have a big bald spot, or men, right in this area. So we'll get to that. The other thing is the incision in front of the ear. Some people make a straight line incision, and there are really very few, if any, straight lines on the face. So we want these incisions to be nice and curved to follow the natural contours of the face. These incisions can be made in front of or behind the tragus. The tragus is this little piece of cartilage that sticks out in front of the ear. And if this is not done properly, you can, this tragus blunts or disappears, and it looks very unnatural. The next thing are the incisions behind the ear. And again, one of the biggest things about facelift surgery is to make these incisions that they're hidden in the hairline, and you don't disable the patient's ability to wear their hair up or to wear any hairstyle. So I unfortunately see many terrible facelift incisions because the surgeon just didn't understand how to incorporate these in the hairline, okay? And again, I don't have hair, otherwise I wouldn't have this loose neck. I'd have a nice tight neck. And so I guess someday I'll have to let my hair grow if I want to have a facelift. Now, the next thing are earlobes, and you see people with pixie earlobes where they're pulled down. Again, this is frequently from a surgeon that does not understand the nuances of facelift incisions. So if you have experience, you pay a lot of attention to this, which I always do, and you do it correctly, it's almost impossible to see facelift incisions when they're done properly. You'll always have that one or two patients that they just don't scar gracefully. They have bad C-section scars or abdominoplasty scars or breast incision scars, and those people will have to treat with steroids or laser, but 99.5% of facelift patients will heal imperceptibly when done correctly. So I'm going to walk you through a presentation on how this is done, and hopefully it will provide insight if you're considering having a facelift.
Okay, I'm Dr. Joe Niamtu, lovethatface.com, and we're going to discuss scarless facelift incisions. Now, these are patients that have walked into my office that were not treated by me. They were treated by other surgeons, and if you notice, these are very unacceptable facelift scars. They're unacceptable for a lot of reasons, but mostly because of the way they were placed. There are very few straight lines on the human body, and especially the face, and you have to follow the natural anatomy of the surrounding structures, such as the ear, and if you don't, you're going to have these visible scars. Also, if you make your stitches too tight and put tension on these wounds, or if you stretch the skin too much, you can get this light hypopigmentation, which even makes it worse. So it's very unfortunate that somebody would pay the money and take the time off to have a facelift and end up with scars like this. Now, this is my routine facelift incision marked on a patient before surgery. And I want you to notice in the sideburn, this scar is in the hairline. It's not below the hairline, and we are not going to move this sideburn. And I will explain to you what a mistake that is when people move the sideburn. And we have these nice curvilinear incisions that follow the natural anatomy of the ear, and all of these hairline incisions are going to be hidden. Now, here are two patients that consulted me. Again, I was not the surgeon here, and in an effort to preserve the sideburn, this surgeon went all the way around the sideburn, and same thing on this unfortunate patient. So some people are literally disabled. This is also a poor earlobe incision. So it's very important, if you're going to have a facelift, to go to a surgeon that really understands the nuances of making and crafting beautiful incisions. Now, when we make incisions in front of the ear, we can do it two ways. We can go behind the tragus. The tragus is this little projection of cartilage here that's in front of your ear, where you stick your finger in your ear. You can go behind the tragus, and that's nice because it hides the scar, but there's some problems with that I'll talk to you about in a minute. Or you can go in front of the tragus in a nice curve. And this is what I prefer doing. And the reason is that here is a patient where somebody went behind the tragus, and yes, they have a hidden scar, but the problem is that the tragus is very fragile and it's cartilage, and it can contract during healing. And this is called a blunted tragus. And on a lot of people, you can see right in their ear canal. So to avoid that, I like the incision that's in front of the tragus. So to avoid that, I like the incision that's in front of the tragus. Now we're going to move to the temporal tuft. You'll see many plastic surgery textbooks that show a hockey stick type incision like this. It extends up into the temporal region. That is something that you really want to avoid, because when you pull the extra skin, what it does is makes a big bald spot here because it removes the sideburn. And unfortunately, again, this is another patient that walked into my office who was treated elsewhere, and it's so unfortunate because this is so hard to make this better. And again, you have to go to a surgeon that understands how to put incisions on the face in the best way to do it. So when I make my sideburn incisions, I make them within the hairline in a very special manner, which I'll explain to you. But when these heal, they're going to be hidden by the hairline. Again, this is an actual facelift patient I did the other day, and my incision is within the hairline. And when I close this incision, this sideburn has not moved, and that's going to remain in the natural position. And when this heals, hair is going to grow through this incision, and you're not even see it. Now, when we make hairline incisions, when I make hairline incisions, I use a technique that I describe in my textbook. I call it transfollicular. It's also been called trichophytic. And what you're doing is making a fillet type cut with a very thin beveled edge. And we do this in the hairline. When you do this, you're actually cutting through some of the hair follicles. And although the top of the hair is gone, the bottom follicles remain in place. And then what happens when you put the skin flap back and you have this very strong bevel here, this angle, these hair follicles down here will grow up and they will repopulate and hide your scar. So that's called a transfollicular incision. And again, that's very important when you're making hairline incisions. When I make my incision behind the ear, or the posterior auricular incision, there are several places you can make this, and it really depends on the patient and how much skin they have. You can put it in the hairline, which I frequently do, and again, masquerade it with that transfollicular incision in the hairline. You can put it up higher, but you never want to put it low down here. And the reason is, here's a patient again that walked into my office. I was not the surgeon, and this is just inexcusable. Whatever surgeon did this facelift, really, anybody that ever looks at this patient from the back, if her hair is up, is going to see this incision. So if you make an incision behind the ear, you want to make it way up here because there's very little visible area between the hairline and the ear. If you make it low down here, then it's there for the world to see. This is a patient with one of my hairline incisions, and this patient is only about 6 weeks out of surgery. And as you can see here, it's really hard to see the scar because the hairs are growing back through the scar in the manner that I showed you previous. Now, also, when we are making these incisions, when we're making these incisions behind the ear into the hairline, I like to actually put the incision right in the little crease behind the ear, which is called the post-auricular sulcus. And you can see these are facelift patients that I've operated on, and you can barely see the scar. And on this African-American patient, the scar is a little bit hypopigmented, but that pigment will return. And that's a great way to camouflage a posterior auricular scar. So here is my typical actual facelift incision. So it has 3 curves in front of the ear, around the lobe. It has a transfollicular incision in the sideburn and follows the hairline. But if you notice, there's still hair on either side of the incision. So under the incision and above the incision. And when this is sutured and healed, it's going to look great. So here is a patient 24 hours after surgery, and her hairline has not moved. These are her preauricular incisions, so her tragus is intact, and this is her posterior auricular incision. Again, this is a patient after facelift, and you can see my incision is well within the sideburn. The sideburn has not moved, and once this incision heals, you'll never see it. Now here's a patient 3 months after facelift, and again, she has a camouflaged incision in her temporal area. You can see where my incision was here, or you can't see what I should say. And again, behind the ear in the hairline. So if you know what you're doing and you can craft these incisions precisely, they'll heal tremendously. And I've done over 1,000 facelifts, which means I've made over 2,000 incisions because there's 2 incisions for each person. And doing this and doing facial surgery for over 3 decades, it is that experience that makes you good at doing it. Here's another patient after surgery, so you really, her suture lines are pretty much imperceptible. Here's a male patient, again, looking in front of the ear. Here's where the suture line is, and you just really don't even notice it. Behind the ear, again, it heals superbly if you know what you're doing and how to do this. Here's another patient, and you can see here's the hairline incision. We have not changed her hairline, so this patient can wear her hair up. I see a lot of patients that had facelifts elsewhere. They were done incorrectly, and they have visible scars or misplaced hairlines, and they're pretty much a cripple when it comes to being able to wear their hair up. Here's another patient. So again, this was my incision in front of the ear. It's just, you can't even see it. Behind the ear, you can't even see it. In the hairline, you can't even see it. Another patient, here's the sideburn incision. Here's the incision in front of the ear, in front of the lobe. Back here, you can see a little bit of this incision. This patient has a little bit of hypopigmentation, so we're going to do a little fractional laser on that, and that will hide that. So 2 other patients, again, here's the incision in front of the ear. It's pretty much invisible. Incision in front of the ear, pretty much invisible. You can see the incision here, which is still a little bit red. This is about 6 weeks. And when that pinkness goes away, you won't see that. I already showed you this patient, and you can see where the incision was. And again, there's a little bit of hypopigmentation, but that will repigment. So here's where the incisions were in front of the ear. You can see this incision a little bit. So on people with pigmented skin, sometimes it takes a number of months for this pigment to fill in. But again, this is pretty much an invisible incision. Another patient, so here's the incision in front of the top of the ear, in front of the tragus, the lobe. And I'm really proud, and I put a lot of work into doing this type of incision. And somebody that really cares about what they're doing, a scar is the signature of a surgeon. So that's one signature, and surgeons are known for bad signatures on prescriptions, but you really want this to be a pretty signature. Here's another patient. You can see their incision behind the ear into the hairline. And these are some before and after patients. This patient had eyelid surgery and facelift, so we improved her neck. And again, This patient has no visible incision. Same patient, we did cheek implants and facelifts, so we've improved this jowling and tightened her neck. You can see she has a normal tragus. Male patient, and you can see how we improved his jowling and his neck skin. And this is a picture of the patient during surgery, and this is excess skin that was cut off. So knowing how to do it, which direction to naturally the skin, and how to close these incisions makes a huge difference. And this patient looked older and sad because everything is drooping. We did cheek implants and a facelift, and we got rid of these jowls, improved her neckline. Here's another patient, same thing, with a kind of a turkey gobbler skin excess, and we did a facelift and a chin implant. And look at her before and after scars, and you can see how much skin was removed on this patient. Here's another patient. I did a brow lift, upper lids, lower lids, cheek implants, chin implant, facelift, and laser. So we did a lot of surgery on that patient, but again, she can wear her hair anywhere she wants because I took a lot of time and put a lot of expertise into making a nice scar. Another patient, before and after facelift surgery. Male patient with extreme amount of excess skin here. You can see all this skin was removed and a nice curvature there and an acceptable facelift scar. Another patient, before and after facelift. Male patient, before and after facelift, eyelid surgery, cheek implants, and laser. This is facelift. Patient had a lot of skin. Facelift and eyelid surgery. And again, this is a patient with a high body mass index who had facelift surgery. And if you look at her before and after incisions, they're pretty much imperceptible. Here's a patient that had upper and lower eyelid surgery, cheek implants, facelift, and full face laser resurfacing. And you can make a huge difference when you perform multiple procedures. Another patient before and after facelift. Another patient with extreme skin excess. This is upper and lower eyelid surgery, facelift. And if you look at her post-operative scar, nobody's going to just say, oh, you had a facelift. They might say that when they look at this before and after. So, cosmetic facial surgery is not only my job, it's my passion. I'm a really lucky guy that I get to do what I do for a living because I love going to work. I love my patients. I love my staff. And one commitment I've had in my life is to be a teacher. I've lectured on 6 continents. I speak all over the world. I've written 7 textbooks. I've written 34 chapters in other doctors' textbooks. I've written hundreds of articles on cosmetic surgery. I'm proud that we have won Best Cosmetic Surgeon in Richmond, Virginia 18 times now. And I'm not saying all this to brag. I'm just talking about what I do for a living and how much I enjoy it. And when you look for a doctor for your facelift, you want to look for somebody that has a lot of experience. You want to look for somebody that you can contact, that gives you their cell number. You want to see a lot of before and after pictures. You want to make sure they have an accredited surgery center. And, it's just like if you were going to go climb Mount Everest and you had a guide that had been up and down the mountain 3 times, or you had a guide that over 30 years has been up and down the mountain 1,000 times. He's going to know a lot more nuances. And there are certainly many, many people that can do very nice facelifts from numerous specialties, including plastic surgery, ENT, oral and maxillofacial surgery, ophthalmology, dermatology. So whoever you use, just make sure that they really understand what they're doing. And I hope this little primer on incisions has helped you. And I really enjoyed talking to you, and thank you for your time. I'm Dr. Joe Niamtu, LoveThatFace.com.
I'm Dr. Joe Niamtu, cosmeticsurgeryeducation.com, and I hope you enjoy our free YouTube videos. I want to talk to you a little bit about our for-purchase video series, and if you follow our education platform, you know that in the past I had a very successful DVD cosmetic surgery video series that you would order on DVD. To become more contemporary, we've done it all over, and now it is all online. I spent 2 years and recorded over 300 hours of 1080p high-definition video, and it's fully narrated in a step-by-step teaching manner. This includes, but not limited to, topics such as blepharoplasty, brow lift, minimally invasive facelift, traditional facelift, facial implants, otoplasty, laser resurfacing, chemical peel, injectable fillers, neurotoxins, mole removal, the management of fat in the head and neck, and other topics. I think this is a great review for experienced surgeons and a great teaching tool for students, interns, residents, or anybody that wants to learn about cosmetic surgery. If you go to cosmeticsurgeryeducation.com, you can preview any video, and they're very reasonably priced. When you order a video, you can stream it 24/7, as well as download it so you own the video. I'm really excited, and I think I put together a really awesome teaching series. Check it out, cosmeticsurgeryeducation.com. I'm Dr. Joe Niamtu.